Dear colleagues, gynecological pessaries have been used for centuries for the correction of pelvic prolapse. At the moment, there exist a large number of models and sizes of pessaries. I would like to talk about the choice of size, peculiarities of insertion methods, choosing the model of pessary. For example, the most widespread and popular model is pessary thick ring. As you can see, I'm holding this pessary. It's elastic, it retains its shape after being squeezed. Pessary ring. It's the same ring type, but it has different elastic properties. There is metal wire inside this pessary, and as you can see, the diameter of the ring is different, of course. It's also a model of ring-shaped pessary. It's the same ring, but with a membrane. Here is this membrane. Using our terminology, it's called bowl-shaped perforated pessary. Fungiform or Gellhorn pessary is little unusual for us. As you can see, it reminds a mushroom with a cap and a stipe. Cubic pessary or frank pessary. It's unusual for obstetrician-gynecologist shape. It's like that. How to choose one? How to tackle this choice problem? So, the choice of pessary type. What does it depend upon? The choice of pessary type depends on the type of prolapse. It is considered, and it is really so, that in case of anterior prolapse, that is, in case of testacella, ring-shaped models of pessaries such as thick ring, simple ring, show good results. In case of central prolapse or in case of concomitant cervix artery elongation, as you well understand, the genital organs will prolapse through the opening of pessary, so the pessary will have no effect. That is why, in such case, it is more advisable to use a pessary with a membrane, cervical perforated pessary. In case of posterior prolapse, the situation is much more complicated. Ring pessaries in such case do not perform their function. The risk of expulsion is high. In this situation, cubic pessaries and fungiform pessaries are recommended. But these models have their peculiarities. We will talk about them in detail a bit later. So, regarding the choice of pessary size, there is a number of easy ways to determine the size of pessary. They of course don't give you a 100% guarantee, but in general, they significantly reduce the risk of failure during the primary selection of gynecological pessary. The size of pessary will depend upon two anatomical sizes. It's the state of vaginal orifice according to POP-Q classification, its GH distance and TVL distance. To be more precise, it's not exactly that distance, but a part of the section which is situated between the posterior vaginal vault and the upper symphysis edge. How to measure the vaginal orifice? In general, you can use the ruler. It can be measured directly while the patient is on the chair. But it seems to me that it's a bit unethical. It is much easier to do it in a different way. You insert the phalanges into the vagina as during the standard examination, and in a specific situation, you insert 3 phalanges. What do we do next? We take a ruler and measure our phalanges with the ruler, without causing any discomfort for a woman or raising unnecessary questions. How to determine the section TVL? Or how to determine the volume of the vagina? This can be done during gynecological examination. Our usual conjugates -3 or 4 centimeters, but there are also so-called rings for fitting. These are such rings. Most often they are of dark blue color. They are made of very dense silicone. What are they for? We determine the volume of the vagina with their help. That is, we have calculated that we should insert pessary of 65 mm to the patient. We take a ring for fitting of this diameter. The diameter is written on the rim, and insert this ring into the vagina. Then we see whether it is placed correctly. The correct position of pessary in the vagina is like this. I will show you from the other side. That means it should be between the posterior vaginal vault and the upper symphysis edge in a diagonally frontal plane. What are we striving for? How can one calculate that pessary is selected correctly? It's a pessary that eliminated the manifestations of prolapse. That means the patient doesn't have these complaints anymore. Pessary doesn't cause concern, doesn't obstruct the passage of urine. And one more important thing, it's important for the prevention of atrophic disturbances in the presence of pessary. You examine the patient with the inserted pessary and try to fit the phalange between the vaginal vault and pessary. If you succeed in it, that means that pessary does not exert significant pressure on the vaginal walls, and the risk of pressure marks is minimal. How does one insert pessary? Typical mistakes during the insertion of this product. So pessaries are supplied in a packaging, they are not sterile, it is necessary to treat it with disinfectant before the insertion. It is necessary to remember that certain disinfectants may cause the irritation of mucous membrane. That is why pessary after disinfection must be rinsed with normal saline or chlorhexidine solution, in order not to cause the allergic reaction to the patient. Before the insertion, pessary should be treated with lubricant. Any preparation will do, any ointment or cream which is allowed for use in gynecological practice. It's up to you to decide what it will be. We treat pessary, treat it with lubricant, and then we start inserting it into the vagina. Do you see the size of pessary? Here we squeeze it and start inserting. Here I would like to show you one typical mistake that sometimes happens. Also, it's a little bit exaggerated situation. When we see a severe degree of prolapse, we try to insert a pessary of large size. As you can see, this pessary just doesn't fit into the vagina. That means that this pessary is simply too big for this clinical situation. Let's repeat, okay? 3 phalanges, measuring. What do we have? About 50 millimeters. Let's add 10 millimeters. There are 15 millimeters. We get the pessary of diameter 65 millimeters. Where is it in this pile? Now we will find a pessary of close size. Here we go. Ball-shaped pessary. We'll also see how to insert the ball-shaped one. 65 millimeters. The size is indicated inside. We deform the pessary like that, and we insert it into the vagina. Here it is. It is fully inside. Then we turn it into a diagonally frontal plane, so that it would be placed, like I've already said, between the posterior vault and the upper symphysis edge. I will take another pessary to show you. It is placed like that. It will not cause concern in the patient and will probably perform its function. How to remove a pessary? Here, I've got it. It's deformed. I've removed it. How to make the removal of pessary easier? Some models of pessaries already have it. Do you see it? What do you need the thread for? It's needed in order to remove this pessary. Nothing prevents you from attaching a thread to any gynecological pessary, so that the loop would be enough in order to catch it with your finger hand, and pulling by this loop you remove the pessary easily. There exist 2 more types of pessaries. These are rings, but as you can see there is such a bulge on them. Obturator, they call it different. It's a so-called urogynecological pessary. What are they meant for? They are meant for the correction of complicated prolapse complicated by the urinary incontinence. This additional thickening is meant for the fixation of urethra, and it must be placed under the middle third of the urethra. Pessary is inserted. In general, it's about the same. We take it. The only thing is that the thickening must be on top. It's more convenient for us so that the opposite end of pessary would be the guiding point. We deform it, insert it into the vagina, and turn around in such a way so that the thickening would be placed under the urethra. Pessary is placed like that. Bowl-shaped urethral pessary. It's all the same, and it will be placed like that. Additional fixation of urethra decreases the manifestation of urinary incontinence. There are two more pessaries that I would like to talk about. Here are these products, fungiform and cubic pessary. These pessaries are spacious. As you can see, they are totally different from the ring-shaped models in their geometry. They are also different regarding the peculiarities of their use. These pessaries are not meant for long-term use. They need to be removed for the night. That means that a patient uses it during the day and removes it for the night. The choice of pessary size is also a little bit different. If during the selection of ring-shaped models we were evaluating the state of vaginal orifice and we were choosing the diameter of pessary a little bit bigger, here the size of cubic pessary must be close to the size of vaginal orifice. Last time we measured 50 mm. I take the pessary which is close in size. It looks like it is too small, isn't it? Let's take this one. It's clear that we need to treat it with a lubricant. We deform it, that is, we squeeze it. It doesn't make any difference how we squeeze it. And then we insert it into the vagina. The thread must be placed in such a way so that it would be turned to the vaginal orifice. Here is how cubic pessary is placed. Owing to its concave walls, it gets adhered by suction to the vagina and provides additional fixation. Let's show it inside, as far as we can do that. How to remove this pessary? By pulling by the thread. By pulling by the thread may be a bit painful, so it should not be done too hard. It is advisable to insert a finger beforehand, to move a pessary a little bit in order to release vacuum, and after that, by shutting motion up and down, the pessary is gradually removed from the vagina. Fungiform pessary also belongs to the category that is worn not for a long time, only during daytime. It is necessary to deform it in order to insert it. As you can see, I squeeze it, and then it is inserted into the vagina, starting with the edge of the cap, and it is placed there so that the stipe of pessary would be facing the vaginal orifice. This pessary is removed from the vagina by pulling by the stipe. There often arise some questions regarding the treatment of pessary after its removal. Pessary after its removal should be rinsed thoroughly with running water with the use of some liquid cleansing agent. It is necessary to pay attention to the areas where secretions might accumulate. After that, the pessary can be disinfected with any disinfectant. Regarding the mode of wearing of pessaries, our traditional mode is wearing for quite a long time. 2-3 weeks, sometimes even more. There is also another mode, short-term mode of wearing. What is that? It's when the patient inserts and removes pessary by herself and wears it only during daytime. It is very important in case of using fungiform and cubic pessary. I hope that this information will be useful for you and will help you to get things straight among this vast variety of gynecological pessaries. I wish good health to you and your loved ones.